welcome to Medical Dialogue Show. I'm Dr. Bhumika, and in today's show, we'll be speaking to one of the top 10 finalists for the prestigious Aster Guardians Global Nursing Award. Ms. Nilima Pradeepkumar Rane, a nurse from India, has been selected as one of the top 10 finalists for the prestigious award, a recognition given to outstanding nurses who have significantly contributed to the field of healthcare. Competing for a 2 crore prize, Nilima's selection shines a spotlight on India's nursing community on a global platform, underscoring the critical role nurses play in improving patients' outcomes and strengthening healthcare systems worldwide. She currently serves as the president of Nursing Association in the Goa State branch and is a member of Indian Nursing Council. We welcome you, ma'am.
Thank you, ma'am, for giving me this opportunity.
Okay, so moving on to the first question that I have is, can you share a bit about your journey into nursing and what motivated you to pursue this career?
In short, my journey started when I was an inter student. There was a medical camp at Kankona, my village, where I was studying and residing. So I had an opportunity to participate as a volunteer for the camp. And I was seen that day, nurses and doctors, they work so closely hand in hand to give better patient care. And it motivated me since then that to join nursing, and I have pursued my nursing journey after passing my inter government higher secondary, that is Kankona. I have taken admission for earlier year Goa. We were serving only diploma courses in nursing, so I joined general nurse and midwife course in 1980 at a nursing school Altino Penjim. I have completed my diploma in 1984, and then I got a job opportunity at Goa Medical College to serve as a staff nurse. And it inspired me that since then that I need to. It became my desire that I need to serve for needy and helpful patient, to help them during their sickness and see their recovery, which gave me very pleasant moment, and I got a job satisfaction in that patients are improving very fast. Then in 1999 I became active member of Trained Nurses Association of India, and I have taken small issues to government, starting from my hostel where I was staying. That infrastructure was involved, and that I wrote to my authority where I was working, and with amicable solution it got resolved and we got relief from them. Then later on I came to know that if I approach certain authority, then things are getting done. But same time I had a fear in my mind, because since we join a government service, we have fear that we may get some memorandum, then our promotions and all, so on things are there. Then I consulted my NGO how to move about. And with the help of my TNA headquarters at New Delhi, I have taken these issues up. Then it came pending allowances of nurses at Goa from 1995, which I got solved from Goa government with a better settlement in 2007. Then we had an issue of establishment of a nursing council, because Goa we didn't had a pretty 50 years almost council, and we were affiliated to the Maharashtra Nursing Council, and it was difficult for our Goan nurses to go there for a 5 years period registration. And earlier there were all logistic were involved, like transport, stay and all. So it came to my mind to a bill. I have drafted a bill in 2004 and submitted to the Indian Nursing Council and government, but saying that it was a old draft, it has been rejected. And then again they have given me, you have to go like this way, short. So again second draft was forwarded as a bill, Goa Nursing Council bill in 2008 to the government of Goa, and it took pretty 5 to 6 years to get it resolved, and a Goa government assembly passed that bill in 2012. And then formation of a Goa Nursing Council and establishment and full formation happened in 2014. And now we have full-fledged Goa Nursing Council, who is the registering authority, licensing authority for nurses. And we have registered so far almost 5,000 members and above. And then Or earlier we have only two government nursing schools, and it was phased later on as a BSc nursing. So then one private nurse, 1+1 private nursing was there. And for the, I think, authorities, those who want to apply and start new nursing colleges, for also them, they had a problems to get all border sanctions, permission, inspection, so on. And now last year we had three new nursing colleges started in Goa, and which benefited to around 450 nursing students to take admission in our own state. And earlier, our nursing students were going to neighboring state to seek nursing education, and which now they can avail in our own facility at Goa. And while doing all this, uh, our nurses write to government. I have to go to many people requesting them follow up. Every alternate day follow up. Even I was asking them when should I come to next. And that way, with a better communication with our bureaucrats, authorities, all things settle well, and we are having full-fledged nursing facility in Goa now, and our intake of students also increase, intake of nurses will increase, many patients will get better care, they will be getting, patient will be getting better attentions. All these facilities happen. And now also minor thing issues are pending with government, which I am doing follow up, and I feel that accordingly with constant approaches it will be get done. And they are, because our approaches, we go amicable solution for any negotiation with the authorities, and they respect our decisions, and they come out with a better solution for implementation, but it takes time. These are the things which I have faced.
That's a really inspiring story, ma'am. Really inspiring story.
Thank you.
Okay, coming to this next question is, how do you feel being named as one of the top 10 finalists of such a prestigious nursing award?
I feel very incredible and honor, and I'm very grateful to the Aster Guardian DM Healthcare for choosing me one of the 10 among 10 finalists, and they have given me platform to voice out worldwide the nurses critical role, and what nurses are facing. And I'm thankful to Aster Guardian, and it's a very nice opportunity, and I'm very happy, and I feel that seeing this, many more nurses also will get inspiration to take up nursing profession also, because there is stigma still at in our society to take up job in nursing, not like earlier time. So I feel that more and more younger generation will inspire to take nursing courses, and we will do better and better, good optional patient care, and with good nursing support, improved nurses ratio, then burnout will be solved. And when we get more and more nurses coming in this field, many people will benefit also. Now we have a gap in rural areas. Urban areas are well advanced, and well people are getting health facility better way, but there is a gap in rural area, which I feel that coming years it will going to fill. And this was happening because of acute shortage of manpower, not only nurses, doctors, paramedics, and other support staff also. So I pray that we India should shine on the in the map, world map, for a better health tourism, because which is just introduced, and our healthcare is more accessible and affordable, I can say. Because recently I did not mention, but I was with my daughter at US, and one of the leading institute, I had been with a medical emergency, and I was not means my family, my person was not getting attention for pretty 7 hours. This felt me very bad. Developed countries are not giving that much better care, I feel, that compared to India. This is my present experience.
Yes, ma'am. But your thought process is great, ma'am. So, moving on to the next question is, what were the biggest challenges that you faced while working on the impactful projects, and how did you navigate those challenges?
Basically, challenges for the time constraint, my family, my job, then other events. As a leader, I have to organize so many in-service educations. Then there is some welfare issues of nurses, so many phone calls, so many approaches, so many problems which we were facing workplace. That I have to go and personally intervene and take their nurses issue as a rightful matters to the authorities concerned and our government also, and as to explain them what is the exact problem and where we are lacking and what I need from them. But even here also there was a gap, I can say. Some people were saying, why you want this, why you won't require this, why you are coming to trouble, and so many things. But I happily now I used to accept and I used to say, thank you very much. When should I come next? I'll come tomorrow. You say timing 3 o'clock, 4 o'clock, like that. I used to ask them back. And transport also that time was a mean. I used to take a local bus, go to official authorities, secretariat, and all so on, and all that way I used to manage. Same time I used to manage my family also. But the more difficult thing was my navigation to that place by mode of traveling, you mean to say, or that connecting people and reaching on their given appointment time, doing my duty promptly, whichever time I'm supposed to serve government. And this what extracurricular activity I was doing during my extra off time, when I was a weekly day off, when my shift was there, a night shift, daytime I used to go for a follow-up. And this way I had many problems which I faced and gone through, and but I am determined to get it done. And in not only this, even I have taken so many help for the people whom I know, like somebody is working on top position, then how to go, whom to contact, then a small contact I used to get from some people, go meet this person, then this way. Even I will give one example. There was this our nursing allowances issue. One lawyer I have consulted to approach to the court as a legal matter. Then that lawyer told me, see, madam, you will pay me my fees. Pretty 2 to 5 years, this matter will remain pending at the court of law and nothing will achieve. So if you better consult some person who is influential, through your means you can get it done. Then I started searching my contacts, and through contacts many people helped me, and this way I have reached to the higher authorities. And when I was entering in office also, one my higher authority said, just I am giving prospective, you don't ask for retrospective allowances, because financial problem was there at that time in the state. And happily I accepted, sir, go ahead with retrospective, let's start. So these are my approaches, and this way I started getting a way of communication to communicate with them, and it happened peaceful manner without any trouble. Most of the orders are got sanctioned, our nurses are benefited, we are getting better, I can say better salaries now compared to 1984 what we were getting earlier. And I need more also require, some issues are pending, so we are asking them and we are waiting when our turn will come. So accordingly we'll accept when they pass the bills and implement the orders. So this is the opportunity given by our authorities also, and they heard our nurses' grievances and problems. And even during one time I remember when there was a acute shortage, 30 patients in one ward, and we two nurses were working each shift, and we were not able to give proper attention, we were getting burnout. Then I wrote to the authorities, government, and I shown them 2 years back medical record department data I have collected data, and I've shown them how increase in the outpatient department patients, admissions increase, deliveries increase, operation increase, and all this I have properly framed and put before the government. And I told them these are the bad strength, and we need this much less nursing manpower is there, and we need to fill. And the government assured me they are giving it phase manner. Like means I had demanded worked out it was 157 I remember, and 7 higher supervisory post. They sanctioned first slot 15 staff nurses and 7 supervisory post. Second slot 50 and third. Accordingly, the manpower also filled. And now, as and require, our government is doing pretty well here, and we are getting leave vacancy. Earlier, they were not giving leave vacancies, maternity leave vacancies, study leave vacancies. Now, those also replaced by the contractual staffs. Those who are pass out newly nurses, they give them opportunity to serve as the contract staff, and later on, eventually, they obtain them in a full service.
That's really inspiring, ma'am. Really inspiring. So the next question is, if you win the 2 crore prize, what are you planning to do with it?
I have my some family background. My mother died at age of 35 when I was 11 years old with a heart attack. My father died with a massive heart attack later age. My maternal both grandparents, one who were looking after us also, they expired with a massive heart attack. So some glitch you can say remain in my mind that I have to do something for this problem. Then now I have decided if I win this prize, I will set up a basic life support training center and acute cardiac life support training center, and mental well-being education for the working nurses at our my college school. Now it is college where I am an alumni. I'm trying to set up some labs to the student for the some volunteer also can learn from their training programs, and we can so better in our communities and villages. And because first when person get attack is required to know basic things, and the cardiac support is very very essential, which we can keep patient alive. Because I had also one challenge when I joined in 1985. I still remember those days patient we did not have a specialized more department, and they were patient neurosurgery also and surgery where we have a mixed department. So one boy was posted for some surgery. He was a 10-year-old. I don't remember his name and diagnosis, but I remember the incident. And pre-operative procedure that we have to prepare patient for surgery one day prior. Like if he have any ornament to be removed, he got the hair growth that is to be shaved, all that things we are doing. So while shaving his scalp, I noticed that boy was sinking, and only patient and relative were around, nobody else was there. Then I shouted loudly for help, and next to my ward there was a operation theater and recovery room where doctor heard the noise. They came running. This emotional moment also touched my heart somewhere. And one day I had gone for the marketing. People started me hallowing. It was a parent of that boy, and they showed me this is your boy. I don't remember them that time, but they recognized me, and this way they have given me honor.
All right, ma'am. My last question to you is, what is your message to those considering joining the profession?
My message is for the youngster that they should join for nursing. Nursing is the best profession. Some families they don't want to send girls for nursing profession. There are many things. Their cultural views also there. Then family views also there, and even people are means younger aspiring people think that nursings are overworked. We are overworked. Acute shortage is there, not paid proper salaries. All these aspect in their mind, and so we make awareness to join for nursing. When I have opportunity to meet my college where I was an alumni, they called me one day for to give talk to the 12th standard student. I told them nursing is the best profession and one should have dedication to serve. Those people only can join it, and you can make best out of it. And I really feel that we are carrying patient need when very closely, and we learn them closely how, because I remember when I was treating my patient at hospital, if they don't have word to say thank you, but it that tears are dropping for their eyes, that I have noticed. Even during now, when before my retirement, I had some migrant worker in my workplace. Being a government hospital, they were treated free. They were getting all treatment free till they are admitted in the hospital. But when once they are discharged, there was no place to go back to them. They did not have clothes also to wear, no money to go back to home. So after recovery, with consultation with my department head, and I used to ask my department head, should I make some arrangement to send them home? They said we are most welcome, because they were occupying hospital beds, and we now growing population. We need acute bed shortage, so we require more and more beds. So when my professor gave me green signal to go ahead, I started contributing myself. So from my salary, I used to keep every month 2,000 aside. Then I used to ask my colleagues to contribute some 50 rupees at least. Then my some intern doctors, some resident doctors, 50 rupees at least I used to ask them from per month. And that way I was crowdfunding. And then I had some clothes at home, so I used to take some clothes for them, and I used to send my one of the co-worker to railway station to book their tickets. First, I used to take permission to send them home with patient permission, whether he wants to go or he want to stay back. So when they said yes, I used to book their train tickets. Then my colleague had a vehicle. Used to, after getting discharged, we used to make him sit in the vehicle, take him to railway station, make him sit comfortable in a railway coach. Once railway left, we used to come. That way I helped them to go home, many people. And I got a deep satisfaction that someone's help in need, I help them, and it's a great thing. Similar way, my authorities also one day asked me, where these people are going. That was one survey. One officer had come to ask me, there are so many so many people were there. Other places they are there, but your workplace they are not there. Where they are going? Then as a hobby, I had maintained one small book, and I used to write their names and keep whom I send home. So I shown them book. This person is from so and so place. This person is so and so place, and they need to go home. So I send them with my consultation with my doctor once they are discharged from the hospital. And my concern to send them home is that after recovering from their health issue, they were getting infected in the hospital, and they used to again go in a back state, and they used to sometimes some people used to die also. So that was my concern, at least to reunite with them, with their families when they are in need. So it gave me great pleasure, and I really felt very good about it. And it is supported by my team also. My credit goes to my team also.
Thank you, ma'am. Thank you so much for speaking to us. It was a pleasure having you on board today with us. Thank you.
Thank you, ma'am.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.